My name is Simone Shaw. Today we'll be discussing enhancing patient safety and quality. This presentation is done in partial fulfillment of the course Legal and Ethical Issues in Healthcare Administration. In this presentation, I will address different aspects of healthcare management. Since healthcare leaders today face complex regulation and licensing requirements, I will summarize the main regulatory accreditation and organization compliance policies. I will outline critical areas which are of biggest importance when it comes to safety of patients. I will also explain the ways quality can be utilized as a core principle to guide efforts made by organizations to control costs. The aim here is to see how policy can be applied practically by examining real-world examples and strategies. Additionally, exploring the mechanism of the law, identifying its strengths and weaknesses to advocate for reform is one of the main objectives. Health managers are to view regulations as practical boundaries that influence the sharing of risks and allocation of resources. Discrepancies between licensing and reporting obligations significantly impact various compliance expenses. Strict privacy regulations create obstacles for care teams in sharing information effectively. According to Ibrahim et al. 2022, regulations assist leaders in establishing guidelines, educating staff, and implementing systems to monitor factors that reduce legal liabilities for the benefit of patient safety. Effective leaders need to be aware of their management ability and conduct themselves in a manner that showcases their competencies in this area. Accreditation is critical since accredited organization tends to adhere more closely to quality standards and control methods. When the latter elements are properly followed, it fosters internal guidelines, lessons are learned from errors, and there is accountability at the board level. This is why accreditation offers many advantages and getting it is a necessary action. According to Lamar et al. 2024, it is important for managers to make certain that licensing standards are more effectively aligned with employees' action. Furthermore, it is critical to make sure that the standards are actively integrated into daily tasks rather than merely serving as reference. The role of the department managing compliance is to stick to legal, scientific, and practical control measures. Organizations with robust healthcare oversight mechanism and dedicated compliance teams excel at identifying risks and responding collectively. Al-Mewari et al. 2024 note it is essential for leaders to push for mechanisms that allows individuals to communicate issues whereby eliminating barriers and fostering transparency. Additionally, their additional role is to ensure that data systems are properly maintained to allow for continuous monitoring. Consistent control and varied assessment emerge as crucial indicators of compliance. Daily, hospital management faces various challenges, including maintaining confidentiality, monitoring licenses, and fulfilling their reporting obligations. This indicates that they require straightforward guidance on how to proceed with tasks. The stringent regulations governing privacy dictates how data is managed and restrict our ability to access information. Obtaining a license demands ongoing verification and continuous development in one's profession. The Agency of Healthcare Research and Quality 2024 states that compulsory events reporting requires an inquiry and a rationale. Managers may find it difficult to swiftly gain insight from their errors, while adhering to established guidelines. Hence, it is crucial for them to implement safety measures and emphasize the significance of keeping everyone informed about the situation. The accreditation cycle starts with an open self-assessment process and ends with actual procedure being tested against stated policies. Companies taking a strategic approach to self-discovery frequently expose hidden challenges and can point to ways of addressing them before employees take the survey. The Commission and Accreditation of Healthcare Management Education 2023 discusses documentary rigor. This is where staff awareness of standards and shift-to-shift operational consistency are necessary for survey readiness. Decisions regarding accreditation are often based on whether and how regular corrective actions occur, instead of being episodic in nature. Critical areas to ensure patient safety. Patient safety is the outcome of a system of practices that includes leadership culture and strong procedural protections. Leaders must prioritize, distribute resources, and normalize transparency. For instance, infection prevention is fundamental and draws attention to the basics such as hand hygiene and environmental cleaning. According to Abraham et al. 2022, system that makes medication safety better can greatly lower harm, which include pharmacy reviews, auto reminders, and or reconciliation. Clearly defining processes for handling handoffs, such as using the iPass mnemonics, ensure that there are no unnecessary breaks in continuity or coordination of patient care. Leadership culture and staffing. The leader's actions significantly influence whether safety becomes an everyday standard or remains an aspirational target. Leaders who prioritize integrity and the development of their team encourage open communication and the sharing of knowledge among employees. According to Ender Lamar et al. 2024, establishing a mentally secure environment promotes timely alerts and accurate evaluation of situations, while also preventing errors that occurs when individuals are fatigued due to insufficient staffing. Effective strategy involves consistently assessing abilities, dedicating time for education, and having a robust leadership that prioritizes safety. Infection prevention and control. Effective infection control depends on rigorous routine and robust supply chain to work consistently in a crisis. Fundamental measures include hand hygiene, environmental cleaning, and personal protective equipment use must be mandatory practices that are audited regularly. Almarer et al. 2024 states that early detection surveillance mechanism is used to enable prompt public health intervention and vaccination to help protect patients and staff. Managers should also organize procurement, staffing, and training to prevent system weakening when it is under pressure. Safe medication and technology practices. Owing to advancement in technology, collaboration, and the active participation of pharmacists, a greater number of medications are now considered safe. Making certain that medication reconciliation is accurately performed during admission and discharge eliminates errors and unnecessary tasks. Using barcode scanning and decision support tools, for example, the heparin infusion anti-XA protocol or verification through dual sign-off, significantly reduce the likelihood of delivery issues. The Agency for Healthcare Research and Quality 2024 discusses the impact of clinical pharmacists on RUN, focusing on their influence on medication usage and patient outcome. It is crucial to utilize learning technology that captures near miss and assists in redesigning procedure to minimize errors. Communication and system resilience. Robust technology or integrated into these communication tools so the issue in one area do not propagate throughout the entire network. Message clarity is achieved via standard handoffs, schedules, and readbacks. Incident learning tools can also utilize data to yield effective solutions. The Commission on Accreditation and Healthcare Management Education 2023 mentioned this approach is tied to resilient planning, which is done by incorporating additional capacity and continuity process. The latter enables safety since it can be mentioned even in challenging situations. Leaders must go beyond mere relying on data for managing decisions grounded in real-world dynamics. They should also incorporate matrices of impact. Using quality to guide cost control. In summary, it is necessary for healthcare managers and leaders to fully comply with regulations, accreditation requirements, and organizational policies. Doing so allows such organizations to keep high care quality. It can also lead to greater organizational performance by encouraging one to concentrate on what truly matters rather than merely relying on numbers. Compliance reduces unnecessary wasting of key resources by identifying weaknesses, preventing negative occurrences, and enhancing essential procedures. By analyzing the outcome, one can concentrate on implementing adjustments that reduce costs and enhance patient care. It ensures that managers rely on data-driven decisions rather than outdated procedures or practices. This way, they can integrate more efficient processes with top-notch healthcare.